Hey everyone, and welcome back to my channel. For all my new friends out there, I'm Nurse Miriam, and I'm here to help you conquer the NCLEX and officially become a registered nurse. Passing the NCLEX is about so much more than just memorizing facts. It's about thinking like a nurse and applying your knowledge to real-life patient scenarios. One of the areas I see students struggle with the most, and which happens to make up a huge chunk of the exam, is medical surgical nursing, also known as Med-Surg. So many students find themselves overwhelmed by the sheer volume of information. But I'm here to tell you it doesn't have to be this way. Today, I'm breaking down the top 5 Med-Surg mistakes I see students making on the NCLEX. And more importantly, I'm sharing my proven strategies to help you avoid these pitfalls and pass the NCLEX with flying colors on your very first try. Let's jump right into mistake number 1, memorizing without understanding. I know it's tempting to just cram in as many facts as possible, especially when you're feeling the pressure of exam day looming. But trust me, simply memorizing facts is not enough. The NCLEX wants to know that you can think critically and apply your knowledge to real patient care situations. So instead of just memorizing that a normal potassium level is 3.5 to 5.0, ask yourself, what happens if my patient's potassium level is too high or too low? What are the risks? What signs and symptoms might I see? And how would I intervene as a nurse? Connecting those dots is what sets apart a truly prepared nursing student from someone just hoping to pass the test. For example, let's say you're studying diabetic ketoacidosis or DKA. Of course, you need to know the pathophysiology behind it, but don't stop there. Imagine a patient with DKA. What are their vital signs likely to be? What kind of electrolyte imbalances would you expect? What interventions would you prioritize? By painting that picture in your mind and connecting the dots between the disease process, symptoms, and nursing actions, you'll be much better equipped to answer those NCLEX questions with confidence. Remember, the NCLEX doesn't just want to know that you can regurgitate facts. They want to see that you can think critically and apply your knowledge in a clinical setting. So, ditch the flashcards and focus on understanding the why behind the what. Your future patients will thank you for it. Let's move on to mistake number 2, which is a big one: poor prioritization of patient needs. In the real world of nursing, you'll constantly be juggling multiple patients and tasks, and the NCLEX will absolutely test your ability to prioritize. Thankfully, there are a few golden rules that can guide you. First and foremost, remember your ABCs: airway, breathing, and circulation. These are always your top priorities, no matter what. If a patient's airway is compromised, that's your first concern. Next, think about acute versus chronic conditions. An acute change in a patient's status always takes precedence over a chronic stable condition. For instance, if you have a patient experiencing chest pain and another who needs their daily insulin, you're going to address their potential cardiac issue first. Finally, always prioritize actual problems over potential problems. A patient who's actively bleeding needs your attention more than a patient who's at risk for falls but hasn't actually fallen. To really master this skill, I encourage you to practice as many priority and delegation questions as you can get your hands on. This is where having a solid NCLEX prep course or question bank can be a game changer. check out nursecareerblueprint.com for more NCLEX resources. Chapter 3. Alright, let's talk about mistake number 3. Ignoring keywords in the question. This one's a silent killer because it can trip you up without you even realizing it. The NCLEX is notorious for its tricky wording, and missing those crucial keywords can completely change the meaning of a question. That's why it's very important to slow down and read each question carefully. Don't rush. I used to underline or circle keywords in the question stem to ensure I didn't miss anything. Words like best, most important, first, initial, priority, and their negative counterparts are your clues. They tell you exactly what the NCLEX is looking for in your answer. Before you even glance at the answer choices, ask yourself, what is this question really asking? For instance, is it asking for the best nursing intervention, the priority assessment, or the most likely complication? Once you've identified the keywords, keep them front and center in your mind as you evaluate the answer choices. This simple strategy can make a world of difference in your NCLEX score. Chapter 4. Moving on to mistake number 4. Overthinking or second-guessing yourself. I know it's easier said than done, but you've got to trust your gut instinct, especially if you've put in the time to study effectively. Remember, the NCLEX is ultimately testing your clinical judgment, not your ability to outsmart the test makers. If you've prepared well and an answer immediately feels right, go with it. More often than not, your first instinct is correct. Now, I'm not saying you should never change your answer. If you read through all the choices and another one makes more sense, by all means, switch. But don't fall into the trap of second-guessing yourself into oblivion. That's a recipe for anxiety and often wrong answers. One way to get better at trusting your gut is to practice with simulated NCLEX exams where you can't go back and change your answers, just like the real deal. This will help you get used to making decisions and sticking with them, building that confidence in your clinical judgment. Chapter 5. And last but not least, let's tackle mistake number 5. Not managing your time effectively during the exam. Time pressure is a real thing, and it can make even the most prepared nursing student crumble. The key to conquering the clock is twofold. Practice your pacing and don't dwell on questions for too long. Aim to spend about 1 to 1.5 minutes on each question. Of course, some questions will take a bit longer, while others you'll breeze through. But having that target time in mind will help you stay on track. If you find yourself stuck on a question for more than 90 seconds, take a deep breath. Make your best educated guess and move on. Don't let one question derail your entire exam. Remember, you don't need to get every single question right to pass the NCLEX. It's also crucial to stay calm and collected throughout the exam. Easier said than done, right? But trust me, when you're calm, your brain can think more clearly and make better decisions. So, take those deep breaths, stay hydrated, and believe in yourself. And there you have it, on the top 5 Med-Surg mistakes to avoid on the NCLEX. Remember, prioritize like a champ, trust your gut, and manage your time. For more tips, download your free NCLEX study guide at nursecareerblueprint.com. Please give this video a thumbs up and subscribe for more NCLEX strategies. I'll see you in the next video.